HIV. The history of HIV. In the early 1980s in the United States, physicians in New York and California made the first observations of new infectious disease of homosexual men. There was a sudden appearance of a rare skin cancer called Kaposi sarcoma. And there was also these brown nodules, that we can see those little brown nodules that's formed by the Kaposi sarcoma. They also noticed an atypical pneumonia caused by pneumocytitis carini, cytomegalovirus infections, yeast infections, candidiasis, and other observed opportunistic infections. The men showed a loss of immune function. So they decided to call this disease the gay-related immunodeficiency, or GRID. All observed individuals suffered from immune suppression. So in 1981, they named the syndrome GRID. In 1982, the disease was renamed Acquired Immunodeficiency Syndrome, or AIDS. In 1983, there was 2,304 AIDS deaths, and also the discovery of the virus causing the loss of immune function, and that virus was HIV. Where did AIDS come from? Well, it crossed the species barrier into humans in Africa between 1884 and 1924. A patient who died in 1959 in Congo is the oldest known case. It spread in Africa as a result of urbanization. It spread worldwide through modern transportation and unsafe sexual practices. A Norwegian sailor who died in 1976 is the first known case in the Western world. Acquired immunodeficiency syndrome, or AIDS, is caused by the human immunodeficiency virus. It's a retrovirus. It has two identical strands of RNA, reverse transcriptase, and a phospholipid envelope containing the GP120 glycoprotein. It mainly infects your helper T cells, your macrophages, and your dendritic cells. It attaches to CD4 receptors and chemokine co-receptors, which are found on your T cells. It finds entry into the host, release of RNA, reverse transcription of RNA into DNA, and integration of the DNA into the host chromosome. So here is the HIV structure, and then it's blown up for you, showing you the spike proteins because it has an envelope. And then it has two RNAs, and then of course it's packaged with that reverse transcriptase enzyme. When HIV comes in, there has to be a dual docking. So besides recognizing the CD4 receptor, it also has to have another receptor being recognized, and that receptor is either CCR5 or CXCR4. Once it's recognized, then there's going to be fusion because we're dealing with an envelope, right? So envelope viruses come in using fusion. And then of course the envelope remains behind, and then we're going to have the uncoating. And then once we have uncoating, we're then going to have the biosynthesis portion. And I'm not going to cover this because we already covered this back when we were covering the virus chapter. Okay, so you can go back and review the HIV retrovirus. And this just shows you how they come out of the cell, so we know that they bud out of the cell, they don't lyse the cell. So why do antibodies fail to inhibit HIV? Well, one, the HIV structure. GP120 makes it difficult for antibodies to bind to the virus surface. The latent virus is hidden inside the host cells. Cell-to-cell fusion method of infecting new cells. The retrovirus evolution is always causing a rapid antigenic change. So there's a lack of proofreading capability by the virus, and there's a very high mutation rate. So we don't always have the same exact strain all of the time. There are two major types of HIV, or clades. In HIV-1, you'll see that we have HIV-1 and HIV-2. So two major types, HIV-1 and HIV-2. Within HIV-1, you have subtypes. Those subtypes are M, O, and N. M stands for major, so it's the most common type of HIV. And M has B, C, and E. So B is North and South America and Europe. C is half of all the HIV infections. So parts of China, India, Eastern and Central Africa, all the way down to Southern Africa. And then E is Southeast Asia. O stands for outlier, and that's mostly Cameroon. And N is non-M or non-O, and there's only been 10 cases that have been identified. AIDS. AIDS is determined by the number of CD4 T helper cells in the blood. Normally, it's 600 to about 1,000, but infected individuals will have 200 or less. So if less than 200 T cells, you are clinically classified as having AIDS. Cells have a shortened life, so your T helper cells have a very shortened life, and your body just cannot produce them fast enough. So we have to use drugs to suppress the numbers of HIV so the body can produce and maintain the T cells. 3 stages of HIV infection: phase 1, phase 2, and phase 3. Phase 1 is asymptomatic or chronic lymphadenopathy. Phase 2 is symptomatic, where you have early indications of immune failure. And then phase 3 is when you have the full-blown AIDS, so AIDS indicator conditions. So here you'll see the number of T cells over the number of years, and you'll see that now we could spread this out for more than 5 years. We could go out to 10 years, even 20 years now, and you see that the person becomes infected, and then the number of T cells slowly plummets. Okay, and they stay within the phase 2, where we try to keep the number of CD4 cells pretty normal. Okay, but of course, if you drop below 200, then you're clinically diagnosed as having AIDS. So HIV can survive 6 hours outside a cell. It survives less than 1.5 days inside a cell. HIV is present in blood, semen, vaginal fluids, breast milk, saliva in very low levels, and in your tears in very low levels. The most common ways HIV can be transmitted are anal and vaginal intercourse, breast milk, sharing of blood-contaminated needles, so IV drug users, blood transfusion, using infected blood or blood products, accidental needle stick injuries, congenital AIDS, so you got it in utero from a mother or child, so transcontinental infection of the fetus or at birth, sharing HIV-contaminated tattoo needles, razors, acupuncture needles, ear piercing implements, and of course organ transplants and artificial insemination. So can kissing and oral sex transmit HIV? Social kissing is not high-risk behavior, so kissing someone in the cheek that has HIV is not going to cause you a problem. However, open mouth, which is French kissing, does increase your risk because it is present in saliva. The risk increases if the infected person has canker sores or lesions in his or her mouth. Oral sex poses similar risks, so if HIV infected T lymphocytes from your semen may enter abrasions or lesions in the mouth. So, ways that HIV is not transmitted, because HIV is very fragile in the environment. Soap and water easily disrupts HIV. HIV is highly susceptible to drying out. Contact with sweat, saliva, or tears is never shown to result in transmission. Handshaking and hugging has not resulted in transmission. And mosquitoes and other insects cannot transmit HIV. These are just some statistics from 2009 showing you the levels of HIV infections, the incidence. So the number of HIV infections is high in MSM, men having sex with men, so white and black, and then it goes onward. Of course, the levels of HIV transmission is much higher in African American males, okay, and then Hispanics going down. Looking at worldwide, of course, Africa, we have a larger amount of HIV infected individuals, and then Central and Eastern Asia, North America, Latin America, and of course in South and Southeast Asia. So how do you prevent AIDS? Well, education. Use of condoms, use of sterile needles, Healthcare workers are to use universal precautions, so wear gloves, gowns, masks, and goggles. Do not recap needles. Risk of infection from infected needle stick injury is about 0.3%. So, what are some difficulties that we're having with creating a vaccine? Well, number one, that high mutation rate. It is consistently making mutations. The number of clades, we saw the number of clades that we are dealing with. Antibody binding sites are hidden, so, they're inside of the cell. We have no suitable experimental host. We can't just inject humans and think that they're going to help us with this vaccine. Proviruses, remember that they incorporate themselves into the host DNA. And again, these viruses are latent. So what's the best way to treat it? Chemotherapy. So you use nucleoside analogs, AZT, that would terminate the synthesis of viral DNA and also human DNA. So we've actually begun seeing drug resistance to AZT emerge. You could have them fusion inhibitors inhibit them from being able to come together. Protease inhibitors, reverse transcriptase inhibitors, so prevent them from being able to create RNA to DNA. Integrase inhibitors prevent them from forming the provirus, so enzyme used to form the HIV provirus. Cell entry inhibitors, so block them from being able to fuse, okay? So block fusion. Of course, usually it's a cocktail that's given to individuals. HART is a highly active retroviral therapy, and it uses at least 3 compounds simultaneously to block HIV. Reverse transcriptase, protease, entry of fusion, and then integrase, etc. Here ends Chapter 12.